Hello again. This is Dr. Sutton with session number 2, Smoking Cessation course. Hope you're enjoying this. I hope I'm not rambling on too long. Being a pulmonary specialist and having the lungs as a target organ, one of the major target organs along with your heart, I'd like to take this session and have you do an assessment package that we will send you. I will send you a copy of these assessments. One is called the Chronic Obstructive Pulmonary Disease Assessment Test. There are a couple of them that are important, and the other is really a Research Council exercise questionnaire. And so let me go first to COPD, as you know, is Chronic Obstructive Pulmonary Disease. If you have smoked for, let's say 15 packed years, we almost surely can measure some decline in your small airway function. It's a little thing on our pulmonary function test that's called the FEF 25 to 75. That's not important you remember that, but we can begin to measure decline. And you know, you have enough lung power. You have 5 lobes, 3 lobes on your right in your right lung and 2 lobes on your left, because your heart sits more in the left and occupies some of the lung capacity. But actually, a person can live with 1 lobe if it's normal. You can take out 4/5 of the lung, and like you can take out 1 2/3 of your kidneys, and the functional capacity that's left is actually able to support your life. Now, not as healthy as with as great an exercise tolerance and as great a strength as if you had all 5 lobes, but you do have enough lung function that you can have some impairment and live a long life if you stop in time. Now, what do I mean by that? Let me tell you that the membrane of your lung, a normal 70-kilogram male, let's say, if you take his lung out and if you were to spread it out, the little membrane where oxygen goes across this way and carbon dioxide comes out and attaches, is exhaled, and the oxygen goes across and attaches in the bloodstream to a red blood cell. That little tiny membrane that ends in a little sac called an alveolus, if you took those and teased them and spread them out, a normal male lung will cover a regulation-sized tennis court. Now, that's how much is exposed to oxygen when you take a big breath in. And when you expire, you blow out carbon dioxide that has come across. And carbon dioxide is over 200 times more soluble than oxygen, so it comes out easily. So when a smoker begins to retain carbon dioxide and their blood level starts going up, it's a very, very serious thing, because CO2, carbon dioxide, CO2, is very easy to get rid of. Carbon monoxide is CO, just a carbon and 1 oxygen. And carbon monoxide is in the cigarette smoke, and it is very avid for your receptors for oxygen on hemoglobin. So when you take a cigarette and you burn the paper and tobacco, as you burn that, and the nicotine is released and so on, that stream comes in, and carbon monoxide is formed with burning. As you know, that's a result of anything burning produces carbon monoxide. That attaches to your red cells and occupies a place where oxygen should be. Well, carbon monoxide is not usable out in your extremities and in your brain and your heart cells and so on for energy. And that's, oxygen is your energizer. So it ties it up and binds, and the carbon monoxide level goes up in your blood from a normal level of maybe 0.9 to, it may go up to 2, 2.5, even over 3 or 4 as a chronic state in a heavy smoker, say 2 to 3 pack a day smoker. So you have a problem. The lung, though, has got this beautiful membrane, very large when spread out, and you're declining, your lung function is declining slightly over time. As you age, your lung ages with you and you lose some lung function, but non-smokers never are limited by their lungs, that you never die because of lack of lung function. But what happens with smokers is they kick into motion this curve that is supposed to be a slow, steady curve over 30 or 40 years and still has very adequate lung function. That incline gets steeper. And a smoker who's got significant impairment of their lung function in 2019, by 2022, has lost a significant amount, and they don't have it to spare. So we can take your decline in lung function of smokers and draw a line down to the likely time of your death within a very high probability. And insurance companies can do that too. They know that your lungs may limit your life. In other words, you may end up on oxygen and on breathing treatments, and if you get ill, you end up in a hospital on a ventilator, some kind of life support. So let me go through these questionnaires and just tell you that your lung is fearfully and wonderfully made. It's a beautiful instrument. It receives the entire heart output, cardiac output at one time, so that you can exercise and your lungs expand, and as your cardiac output goes up, doubles and triples with exercise, the lungs expand and gorge and can handle that, as long as they're not scarred and stiff and reduced in their capacity from your cigarette smoking. If that is true, then as you exercise, they're limited and you get breathless, and the pressure in your lungs, which is a very low pressure normally, maybe 12 over 6, goes up, and maybe 40 over 20 or 40 over 18. That's very high, and that puts the stress on the right side of your heart. So it's very important that you stop smoking before your lungs are significantly limited. So here is a questionnaire that I'm going to drop a slide in right now, and you can watch as I go over this with you. Number 1, do you never cough, or do you cough all the time? From 1 to 5, 0 to 5. And so if you cough sometimes, you may put a 2 or 3. Number 2, how about phlegm or mucus? You see there under number 2, I have no phlegm or mucus in my chest at all, or I'm completely full. That is, almost every morning I can get up and have to get up and clear phlegm when I have my first cigarette and cup of coffee. Number 3, my chest does not feel tight at all, or plus 5, my chest feels very tight. In other words, I'm getting, my lungs feel as if they're crowded. Then give yourself a 5. The next one down, number 4, is when I walk up a hill or one flight of stairs, I'm not at all breathless. Or when I walk up even a small hill or climb one flight, I'm very breathless. In other words, if I climb one flight of stairs, I have to stop at the top and get my breath. Next one down, number 5, I'm not limited doing any activities at home, including some light yard work, or I'm very limited doing activities at home. Next one down, number 6, I'm confident leaving my home despite my lung condition, or I'm not at all confident leaving home because my lung condition means that I'm going to have to be back soon, take a breathing treatment, crowds, hot places, hot days outside, cut my breath. And then finally, your sleep and your energy level. You can see that for yourself. I either sleep very soundly or my sleep is interrupted because of my lungs. I have to cough at night. I have to clear mucus. I'm breathless when I turn over and it wakes me up. And then finally, your energy level. From I have a lot of energy. I can come and go and do as I please to I have no energy, which would be a plus 5. You rank those, you score those, and then put your total score, and you can send that back to me and I'll respond to you. So remember that questionnaire, you can return it to apmi@me.com. Okay, well, that's our session for today. Thank you for tuning in and watching this video number 2 on lung conditions and the effect of cigarette smoking on carbon monoxide and carbon dioxide release and oxygen transport. You're fearfully and wonderfully made, and that's true, so you want to protect your health. So here's to your health from American Pulmonary Medicine.